Good afternoon, and thank you for joining us for this installment of Epic Insight. This is Brian Lenz, Director of Sales and Strategic Partnerships here at Epic, and I'll be moderating today's call. The issues facing those investing for retirement are complex, and getting an early start is critical. But understanding and acting on these issues can be challenging. With today's session, we'll help introduce many important concepts. We'll tackle Social Security considerations, potential healthcare and housing costs, different ways to save, and specific challenges facing women. With us today is Rob Duffey, Vice President and Senior Retirement Consultant for OppenheimerFunds. Rob covers the North Central region of the U.S. and has 19 years of experience in the retirement plan industry. Prior to joining the retirement industry, he worked as a financial advisor for an independent firm in Providence, Rhode Island. As a senior retirement consultant for OppenheimerFunds, Rob collaborates with financial professionals like yourselves to help find innovative solutions to retirement plan challenges and to help advisors grow their business to meet the investment needs of an increasingly complex retirement marketplace. He directly supports financial advisors, relationship managers, and consultants by sharing expert technical knowledge and translating ideas into practical, actionable strategies. As always, your line will be muted throughout the call, but if you have any questions you'd like us to field at the end of the session, we'd be glad to do that. Just enter those in your webinar questions panel, and I'll toss those up to Rob. So without further ado, we'll turn it over to Rob Duffey.
Thank you, Brian. I appreciate it, and good afternoon, all of you. I appreciate you taking some time to join us on the call this afternoon. One housekeeping item before we dive in on the navigation panel that you each probably see on your screens. There is a handout section where we are offering CE credit for this event for various designations, which you will see detailed on that form. So I would ask that as you complete that form, we've registered the event for the 1 hour of CE from 3:30 to 4:30. So please indicate that on your form, sign next to those kind of sign in and sign out timeframes, and then please indicate what designations, if any, you'd like to receive credit for. I'll also ask that you return those forms to me, and that could be done via email or fax. You'll be provided with both of those means of communication, and I would ask that you do that within the next 48 hours. We do use a third party by the name of Reg Ed that will process your CE credits, and they send out your certificate of completion via email. So it's also very important that on that form you include your contact information, in particular your email, and they will get those CE certificates out to you shortly. And with that, let's dive in. So as Brian mentioned, our topic or presentation today will cover a variety of topics. In my travels, and I'm meeting with advisors and consultants and plan sponsors and people that in some shape or form are involved with the administration or service of various types of retirement plans, and therefore helping to build and maintain a better plan for plan participants. And one of the things that we currently hear from folks is kind of an interest and a thirst for new education content. I think we're at an interesting time in our industry right now in that retirement plans have been a hot topic as of late, whether that's just activity that we're seeing in the industry and the evolution of plans kind of changing and getting better. They were a topic of discussion in Washington, D.C. as tax reform was being discussed and retirement plans possibly being restricted or handcuffed on what folks are able to save inside of plans. And at the same time, you're hearing a lot of buzz around other topics that we'll get into, such as healthcare, which has been a hot topic around the discussion of healthcare reform, but also more talk of healthcare as it relates to how we plan and save for retirement. Social Security is always a hot topic, so there's a lot that we'll cover. In fact, as we jump into the presentation, we've broken this out into what I like to kind of frame or consider as chapters. And so our goal in developing this content was to give you folks who are working with plans and plan participants some content that you can then take out to plan participants to help with your efforts around employee education. And we break this into chapters so that the goal on our part in developing this was to arm you all with content that might not just be used in one educational session, but could be used in several sessions as you dive into or choose to dive into various topics. So the things that we'll cover today, as Brian mentioned, are kind of the broad retirement landscape. This is more of a back to basics, kind of how do we feel people should be thinking about retirement as they plan, both in terms of various ways to accumulate savings, but also things that might derail or challenge those savings. We'll talk about healthcare, which, as I mentioned, is becoming a more frequent topic in terms of intertwining with conversations around traditional retirement savings vehicles. Social Security at a high level, because it's always kind of out there from time to time in terms of will it be reformed or changed, or how will that impact savers and retirees. We'll then transition into kind of what becomes savings targets and how should people think about and envision that. And then finally, we've dedicated some information to how women savers and women participants should be thinking about retirement, noting that there are some differences in longevity and savings, and that can impact how we communicate and how we educate women as investors. So with that, I will begin. As we meet with folks, again, we like to set the stage of what will retirement look like. And so I think people have in their minds different ideas of what will be those vehicles that help them save for a successful retirement. Social Security is always something that people have in the back of their mind. And we'll dig into that a little bit later in the presentation. But we like to remind people that Social Security was never meant to be a sole funding vehicle for retirement. And there's a common analogy that encourages people to think about retirement as really a marathon. And like a marathon runner, it requires good coaching and discipline and lots of training. And I think saving for retirement is similar in that way. So you end up with things like personal savings and pensions for those that still have access and are still covered by them, 401ks and things like 401ks, 403bs, and other types of employer-sponsored savings vehicles all become really part of that strategy, because none of those as standalones are probably enough or should be viewed as being something that can get them through retirement to maintain that same standard of living that they've become accustomed to. We've highlighted a couple of things on this slide as well that are things that people need to think about that could derail some of those efforts. When we get into our conversations of healthcare and inflation, you'll see that healthcare and healthcare costs are really becoming something that people need to think through. That can be a sizable expense throughout retirement, particularly later in life during retirement. What we're seeing and have seen over recent years too is that retirees are having to consider taking care of loved ones and family members, whether that be elderly parents or family members, or even younger children, depending on where they are within the workforce. Education is another area that has certainly outpaced headline inflation. It is something that people have to consider and plan for as well. So there's a lot that we can touch on, but I think there's a lot that people should be thinking about as they make some decisions, whether it's in an employer plan or savings that they're doing outside of those plans. And there's some good news as we think about retirement, which is that we're all living a lot longer. Back in the 1900s, the average age of life expectancy was age 49. And nowadays, we're seeing the average life expectancy at age 79, which is good things. We're all living a lot longer, and the probability of living longer is quite good. So if you look at, an individual or a couple who is currently 65 years old today, they have a high likelihood, as you can see on your screen and see my cursor kind of bounce around, high probability of attaining age 80 or 85, which is good, but that also means that it changes how we plan and consider retirement, because retirement's going to last that much longer. So I've touched on healthcare a little bit. We're going to get into that further as well. But the projections of what healthcare is going to cost on an annual basis are really becoming a staggering number. We're also seeing more and more people, as they age throughout retirement, find that they need some type of assisted living or nursing home care. So if you look kind of in the center of the screen, it's roughly only 1% of the population of individuals between the ages of 65 to 74 that end up needing assisted living or nursing care, which clearly sounds like a low number. By the age of 85, that number increases to 10%. Some of you may feel that's a relatively low number as well, but an alternative way to look at that is at the age of 65, you have a tenfold chance of needing assisted living by the time you're 85. So that late in life cost or that late in life event can be something that really derails people's savings as they're in retirement. And then, of course, we have to plan for inflation, which, while it has been at historic low levels for the past several years, CPI right now running around probably 2.1, 2.2%, becomes something that we have to plan for. And one of the challenges nowadays, while inflation has been relatively low, so have interest rates. So you have a 10-year Treasury that's only probably 20 or 30 basis points away from headline CPI, and people need to consider that. So how they build and construct portfolios and how they maintain those savings throughout retirement is something that's changed certainly over the past 10 or 20 years. And what we commonly hear from people as we start to talk about things like savings and what are going to be those vehicles that help you navigate retirement and get you to where you want to be to maintain that same standard of living, we'll oftentimes hear people respond and say, well, hey, I can just work longer. And part of us thinks, well, that's not really retirement, although it might be an option for some. But what we're seeing in some of the studies that have been done of people at retirement age or have officially retired is it's somewhat seldom that people actually do return to the workforce. And those looking at the past several decades, that data hasn't changed a whole lot. So most recently, we saw that just under a third of folks actually do continue to work, but nearly 80% find that they just don't end up doing that. While they thought it might be an option, it never really becomes reality. And that can be any number of things. That can be that they end up leaving the workforce to, again, care for a loved one. It could be that they're just not able to find work in retirement. So this idea of continuing to work or going back to work in retirement rarely is one that comes to fruition as we're getting feedback and more data from retirees. The other thing that we're getting more data on out there is what has been the experience or the findings as people are retiring in terms of how are they finding cost of living and how are they finding the results of their planning and savings as they get to that point of having to now deplete savings and live off those savings. And what we've seen is a sizable number of people, and over on the far left here, the red specifically relates to healthcare expenses, and your black is all expenses other than healthcare. So we've got 37% of retirees saying that they actually found that they had underestimated the expense of retirement. When you look at healthcare as a standalone, nearly half the population are reporting that they just didn't appropriately estimate what those healthcare expenses were going to be in retirement. And so when we underplan or underestimate what those expenses are, clearly we need to make some adjustments. And so what we're finding in some of these post-retiree surveys is that people are clearly having to adjust their lifestyle and their standard of living. They're having to adjust their budget because costs are going towards other areas such as healthcare. In some cases, as we looked at on that prior slide, people are returning to the workforce. It might be that they're depleting and drawing down savings more quickly than expected or planned upon. And in some cases, people are either having to move back in with family or take on debt in order to cover their other expenses and cover some of those healthcare costs. And of course, we have inflation, which I've mentioned. So what's frequently reported in the industry and in the media is that inflation has been relatively tame over the past several years, and it has, which you see on that green line with headline CPI. Where we've seen substantially higher inflation are in two areas that certainly impact people as they plan for retirement or as they're in retirement: medical expenses, which we've touched on and we'll get into further, and higher education. So as people are contemplating how they plan, how they maybe save for sending children or grandchildren to college for higher education or for their own medical expenses, certainly something that they have to consider because it's growing at a much faster clip than CPI as a whole. So let's jump into healthcare. As I mentioned, it's really been kind of a hot topic, whether it's driven by healthcare reform and changes that we may see coming out of Washington, or the result of people's findings in retirement, as we looked at with some of those earlier surveys, which was, again, nearly half of folks are reporting that healthcare expenses were higher than anticipated. And here's what that looks like. And I've seen a few different numbers out there, but all of them substantial. So I've seen numbers that estimate anywhere from a couple of 100,000, in this case over 400,000, for a couple who's currently age 65 and lives to their late 80s. They are in for, at this point, based on the data, some substantial healthcare expenses. And as you can see also with this slide, those expenses really growing and accumulating quite considerably as they age and get later into retirement. One of the reasons for that, and kind of good news, bad news, is, as I mentioned earlier, we're all living a lot longer. Back in the 1900s, when life expectancy was in the 40s, and now we're in the high 70s, that's great. And part of the reason for that, on the left-hand side of this slide, is what was killing us back in the 1900s, which were typically infectious and parasitic diseases, don't kill us anymore. And now we're finding that people are dealing with things such as cancer and diabetes and heart disease and more chronic illness. So the healthcare landscape has changed considerably over time, but there's been good news as well in terms of what we're seeing in healthcare. So pharmaceuticals have been an area where we've seen really a lot of growth and improvement and change. The technology side of healthcare has been something that's grown and changed. And I think that as individuals and as consumers, we've become much better informed as it relates to healthcare. So whether that's diet and lifestyle and exercise, I think there's a lot more knowledge that exists today, far more than there was 40, 50, 60 years ago as it relates to healthcare. So that's all of the good news. And then the downside of it, obviously, has become something that we need to plan for. We're also seeing evolution from healthcare providers. So you're seeing hospitals start to think about how can they partner with and affiliate with community hospitals and maybe move people with less serious illness or less immediate issue out of emergency rooms and into community hospitals. Hospitals and medical care professionals are starting to integrate and leverage technology much more to start to do some diagnostic activity. And how we treat patients, or how the healthcare industry treats patients, is starting to change as well, to be less kind of treatment and post-issue centric, to really working with individuals to create better, healthier lifestyles and to try and be more proactive in an individual's health. So there's some interesting evolution going on in the healthcare industry. One of the things that we're seeing, specifically as it relates to kind of integrating with how people think about saving for retirement, is the increase of vehicles such as HSAs. So what we're seeing in the data is that more and more employers are starting to offer high deductible plans, which means that more and more employees are starting to either use or have access to things like HSAs. Now, as we're seeing talk come out of Washington, or had been seeing talk come out of Washington around potentially changing what we can contribute into traditional retirement vehicles, we're also seeing talk happen in Washington around potentially increasing and really substantially increasing what we all might be able to put into things like health savings accounts. And so it's generating some speculation or some question from many is, are we in this early part of an evolution where employers, just like they did with retirement plans and moving from traditional defined benefit to defined contribution, are employers starting to shift some of that burden of saving for healthcare or funding and paying for healthcare onto all of us as individuals and employees through high deductible plans and HSAs. So as we're meeting and educating folks and getting them to think about savings, HSAs are becoming potentially part of that conversation. Where we are today, in terms of them being a savings vehicle, is outlined on the screen. So currently for an individual, they're able to put in $3,400, and for a family, $6,750. And much like retirement plans, they too have a catch-up provision, in this case for those age 55 or older, of $1,000. So this becomes an interesting savings vehicle, and we're seeing these gain some momentum as more and more employers are offering them. But there's also some interesting kind of strategic uses of HSAs that we're seeing some people take notice of. And so we've outlined a couple of those here on the screen. So for one, whatever is contributed to an HSA has no impact on what we're able to save inside of traditional retirement vehicles. So if I'm contributing to my HSA, that's not going to count against me or handicap what I might put into my employer-sponsored 401k or IRA or what have you. There's also no time limit for using money in an HSA. So if I at some point decide that I want to use this or I accumulate some money that carries with me into retirement, there is no RMD provision. There's no limit within which I must take my money out of my HSA. They're portable. So while I'm employed and working, if I were to move from one employee or one employer rather to another, both of which have high deductible plans, I can move my HSA from one to another. And there's actually a triple tax benefit of HSAs as they're written right now. So I'm able to put in pre-tax money that will then grow tax deferred, and for approved medical expenses or qualified medical expenses, those dollars will come out tax-free. They are investable. So while many providers are really utilizing just kind of traditional money market or cash vehicles, we are seeing some uptick in HSA providers out there that have investable platforms. And as I mentioned earlier, there are tax-free withdrawals for qualified medical expenses. So these are really starting to look like traditional retirement savings vehicles in people. And so there is quite a bit of buzz. So what we've seen from folks like yourselves on the call that are working with plan participants, historically, things like retirement plans were covered by those investment professionals, financial advisors, consultants, but the benefit side of the story was often kind of punted to the benefit specialists, and there wasn't historically a lot of integration between how we educated employees as the end user around these different vehicles. I think you're going to start to see more integration. So we're seeing some folks really just as pure value add start to educate employees around these solutions where and when they exist, because it really becomes part of that full holistic retirement savings strategy. We do like to educate and remind some people of some kind of cautions as it relates to HSAs. So contributions are not allowed once the owner enrolls in Medicare. Withdrawal for non-medical expenses are taxed as ordinary income after the age of 65, so it really becomes very much like a traditional tax-deferred retirement savings vehicle. And like many retirement plans, if there are withdrawals for non-medical expenses prior to age 65, there's a 20% penalty on those distributions from HSAs. Closing out kind of the healthcare and HSA topic, we like to remind some folks or educate them as to how beneficiaries work. So if your spouse is a beneficiary in your HSA, in the event of one's passing, they're able to maintain that HSA in his or her name. They'll have access to those funds and really can use it much like it is their own HSA. And if they are involved with a high deductible plan, can even continue to fund that as their own HSA. If the beneficiary is a child, that account is liquidated upon death, becomes a taxable event. Although if there are remaining medical expenses, those can be used from that HSA to pay those remaining medical expenses. And if they're part of an estate, it becomes they're again a taxable event and is distributed and reported on the final tax return. One of the questions that comes up when we start putting out some of these substantial numbers in that we're showing people healthcare or healthcare in retirement is going to cost several $100,000 potentially, that obviously will generate some questions as to, well, where are some of those expenses coming from? So we've seen, again, what seem like low numbers of people that are needing nursing or assisted living. And to remind you, by the age of 75, it was roughly 10%, but those can be substantial costs. So we outline and spend a little bit of time talking with folks around what various types of assisted living resources look like in terms of monthly expenses, and when you enter those programs, at what point in your life in terms of age or past medical history can have a big impact as well. In fact, my eyes were open to this recently. I was speaking to an advisor who, in his own situation, had a family member, and they were kind of looking for assisted living facilities and resources. And in their mind, they were doing some early due diligence. They weren't at a point where it was needed immediately, but their family member experienced a stroke, and that considerably changed the picture and the outlook. And they were all of a sudden in a situation where those expenses were 2 to 3 times higher what they were originally planning on and thinking about because of that change in their health status. So, these numbers are somewhat very fluid based on each of our individual situations and can change at a moment's notice. Social Security is a popular topic, and we'll transition there. We found a quote from an author, Dave Barry, which was kind of humorous. I care about our young people, and I wish them great success because someday when my generation retires, they'll have to pay us trillions of dollars in Social Security. And this is always a political kind of hot potato and something that we see, but is in everybody's mind, I think, in terms of when we're thinking about retirement planning and what that looks like. Social Security is always part of that picture. And we like to educate people in terms of what Social Security looks like for a given individual, because it does become something very different for each of us. And part of what drives that is a given individual's income, and therefore the income that we need to replace in retirement. And what many of you probably know, and what we like to remind folks is those folks that are at higher income levels, while today, of course, receive Social Security and certainly may receive Social Security in the future, it will replace a much lower percentage of their income than somebody that's at a lower income level. So in this example, somebody that has an earnings level of $20,830 will receive nearly half of their replacement income via Social Security. Somebody who is at this year's maximum taxable wage base of $127,200 is going to receive about 25% of their income replacement through Social Security wage base or through Social Security. So as we're meeting and educating individuals about retirement planning, the Social Security conversation can be very different for each of us depending on what that income replacement looks like. The other thing that we always like to remind people is when we claim and start to receive Social Security can have a big impact on our retirement savings picture. So currently, with full retirement age being age 66, we want people ideally to put themselves in a position where they can at least wait until full retirement age, because there can be a substantial impact on their benefits, which if I can transition, there we go. And there might be some incentive also to delay. So here we look at 3 different hypothetical individuals. Marie, who begins claiming early at the age of 62, Bill, who waits until full retirement age, and Sophie, who delays to age 70 to increase and maximize her Social Security benefit. And again, as I mentioned, the results can be quite staggering. So Marie, by claiming 4 years early and not waiting until full retirement age, is only receiving 75% of that Social Security benefit, whereas Bill waited until full retirement age, therefore receives the full benefit. And Marie, by delaying, gets an increase, which, as we'll see shortly, there's an increase of 8% per year after full retirement age, up to the 132% cap, to enhance that benefit should somebody be able to bridge that gap of retirement to when they start to claim Social Security. And here you can see that laid out in a little bit more detail. So the detriment that can happen of claiming early and getting that reduced benefit versus delaying. So this becomes, again, a common conversation that we have with folks as they near and enter into retirement and decide how do they want to leverage their retirement savings, personal savings, access to employer plans, pensions, all of the things that we looked at the outset of our session today, and how do they plan on claiming or delaying that Social Security benefit. Now let's transition into the question that inevitably comes up, which is how much will I need? So as we educate people about the different sources of retirement savings, those things that might derail, things that they need to plan for, that leads us to the question of, well, kind of what's my number, which you've seen out there in the media, kind of how much am I going to need? What's my bogey? Clearly, that's a kind of a personal discussion, very specific on an individual situation. But what our industry has always done is kind of put this number out there. You'll need about 75 to 80% of your pre-retirement income to maintain and sustain that same standard of living that you've become accustomed to. Excuse me. So here we've outlined that to start to have that conversation with folks, because I think what I've found is it can be rather eye-opening, but it really impacts how people do things within their lives, but also how they do things inside of retirement savings vehicles or health savings vehicles, whatever that vehicle may be. So if you look at across the top of the screen, we've detailed our assumptions. So an individual who's currently age 45 sees a cost of living salary increase of 2.5% a year, has a retirement age of age 65, excuse me, a income replacement ratio of 75, market growth or interest rate of 5%, and we do a present value calculation. It's cold weather in upstate New York is starting to attack my voice. So if we look at just that second line down, for an example, you have an individual who's currently making $50,000 a year, currently have saved $90,000. Their projected salary based on their assumed growth at retirement will be $81,931. Therefore, their targeted replacement of 75% would be that $61,448, which we then compute into a monthly value. We'll estimate Social Security at full retirement age of just under $18,000 a year, meaning they have to make up that shortfall, $43,460, and then the total value needed to fund their retirement based on mortality and life expectancy. Their number, their bogey, becomes that $529,000, call it $530,000. And in order to attain that, we then show the percent of salary that must be saved each year to meet that goal of 14%. So these kind of projections have been around for years, but what we're seeing is that there are clearly a lot of levers that can be moved as people plan for and adjust that number. Now, for some, that can be a scary number. If you're telling somebody that they have to save $530,000 or save 14% of their income, obviously that can be a tough conversation and a scary number to come to terms with. But that's where we have some conversations about levers around, do we adjust what we save? Do we adjust how we invest? Do we adjust when we retire? So there are some things that we have control over. Do we adjust what retirement looks like in terms of our standard of living? But these conversations are also spilling into conversations that we're having with plan sponsors and plan advisors around plan design. So we've seen certainly a sizable uptick in plans utilizing things like auto enrollment, auto escalation. But when those features really first started coming into vogue several years ago, we saw defaults, and we still see defaults starting at 3%, which is the most common. Auto escalation isn't always used. But what we're seeing is more and more industry intelligence come out and say, kind of 10% probably is at least the number that we should strive for. And we're seeing very little difference in opt-out rates if people are starting at higher levels, upwards of 6, 7, 8%. So how we think about plan design outside of how individuals think about saving for their own retirement can be something that has big impact as we educate and meet with employees and start to talk about what those savings goals look like. The other thing that we like to educate or discuss is the conversation around Roth. And again, this became a hot topic as Washington was debating tax reform and possibly changing our ability to save on a pre-tax traditional basis and maybe to convert over to a Roth solution. And Roth was something that has been around clearly for years, but I think was kind of quickly dismissed when it first came about. And Roth is something that needs to be thought about a little bit more strategically. And we put a couple of different examples up here. Somebody that is at the exact same tax rate as they save for retirement as when they're in retirement. So same tax rate with money going in and money coming out. There's really no impact there. It's no surprise if you look at that center, that right-hand column. If you're at a lower tax rate while money's going in, clearly Roth has more advantage if you're at a higher tax rate when it's coming out. And conversely, if you're at a higher rate when it's going in versus when it's coming out, it would seem easy to make a decision about Roth. What we're finding is that many people maybe have accumulated a substantial amount of traditional pre-tax money that is subject to tax upon distribution, and Roth might be a diversifier. Or as people think about maybe transitioning wealth to their beneficiaries or heirs, Roth may have some benefits. Or as people think about required minimum distributions. So Roth is becoming a conversation that we just want to happen more often as people think about how they save for retirement. And then finally, loans. Well, this has been something that's been in and out of the media for years. I don't know that people always think through the impact that can be seen as people are taking loans and borrowing against their retirement savings vehicles. So we certainly recognize and understand that there will always be situations where people want to access their retirement savings prior to retirement through things like loans and hardships. But here we give an example just so that people are aware and will start to think about, is there possibly a better solution than taking a loan against their retirement savings? So here I'll read through just the portfolio so that you have an understanding of it, but we have two hypothetical investors and two hypothetical, therefore, portfolios, both in traditional balanced 60-40 stock versus bond portfolios. They're invested for 40 years. So we have them in the S&P and the Barclays Ag from 1975 through 2015. Both participants are investing at the age of 25, retiring at 65. Both have a starting salary of $40,000. Both have salary increases of 3% per year. Both contribute 6% per year. But you have one participant who takes an $18,000 loan at the age of 40. Following that loan takes 5 years to repay, so standard repayment time frame. During those 5 years of repayment, the participant reduced their 401k contributions from 6% down to 2%. And then while once the loan was paid back, and the non-loan person maintained that level of 6% contribution. So as you see, over those 40 years, everything else being equal, that person that took the loan had roughly $90,000 less in their portfolio. On this mountain chart, it doesn't look like a tremendous amount, but if you think about that, you think back to those earlier slides where this person at the start, at age 25, had a $40,000 salary and had typical indexing perhaps, that $90,000 really could be 2 years worth of replacement income for that individual. So over time, as we educate people about kind of the functions and the bells and whistles that may be available to them in a retirement plan, we want them to think through the long-term impact of what some of these things can have on their overall retirement savings picture. And then finally, transitioning into the conversation that we have with women as investors. We've shared some information around longevity and what that looks like and some of the healthcare costs, but we believe the conversation has to be a little bit different as we speak to women as savers versus men. As we know, and as you saw in earlier charts, women will statistically live to be quite older than men. So a woman who's currently age 65 has a 72% probability of living to the age of 80. So that fact that they will likely live longer probably should change how they think about saving for retirement. The other thing that we're seeing, and this is really kind of a function of their longevity and living to be to a later phase in life, is that healthcare will typically be more expensive for a woman than it will be for a man because of that added life expectancy. So you can see some of those projected costs and that delta between women versus men as it relates to what we believe their healthcare expenses will be. And what we've also seen is challenges as it relates to their income when women leave the workforce. So the most common reason for women leaving the workforce is to take care of children. And the average number of years that women are leaving the workforce to take care of children has been 11 years. And you can see on this slide that while if they don't leave the workforce at all, obviously there is no impact on their salary, but even leaving for a year or less can have an 11% negative impact on their earnings. And over a period of 3 or more years, keeping in mind childcare is typically 11 years, can have a substantial impact of 30 or 37% on their earnings with that time out of the workforce. And so there are some special communications and some challenges that we need to be having discussions about as we educate women as savers and women as plan participants, highlighting the fact that over their careers and over their working days, may be earning less than their male counterparts, may and will likely have greater healthcare expenses. And the other thing that we've seen in the data is that the median retirement savings rate is about $40,000 less for a woman than it is for a man. So, again, as we communicate with savers and with plan participants, I think that we need to be aware of how we're communicating with different groups and different genders, because there are some unique challenges, certainly for women versus men, as they save for and plan for retirement. And so that I will transition into, or if we're able to get back to that chat screen, to open it up for any questions that you may have.
Yeah, thanks, Rob. Appreciate those insights. As Rob mentioned, if you do have any questions, please go ahead and enter those in the questions panel, and we'll throw some of those out there now. One did come in, Rob. Are these? Is this deck available to the public post-call today?
Yes, the deck is available. Brian, I can work with you to push that out to attendees. It's on Oppenheimer's website, OppenheimerFunds.com. It is client approved, and we have it, available in hard copy as well.
All right, perfect. Thanks. We'll make sure to get those out. You touched on HSAs as a significant piece of this. Of course, there is a lot of buzz around these, but maybe not a consistent theme or game plan on how this is actually coming together, who's providing what, and what the role of an advisor is. Can you kind of touch on what you're seeing and what you're experiencing in your conversations with advisors? Is this really just something advisors are going to take a look at and maybe consult with, but not really a moneymaker? Or have you seen strategies that advisors have used to monetize the increasing asset base in HSAs?
Yeah, I think you're right, Brian. I think we're in the very early innings of this. There was a lot of buzz, and the numbers seem to kind of bear out that, it's with the uptick of employers offering high deductible plans and therefore the increase in the people having access to HSAs, it seems as though there's some momentum behind them. You're also correct in that, some of the very initial kind of questions or objections that come out there is, if I'm going to start, possibly if I'm a plan advisor or a plan consultant and start getting involved with these, compensation is something that comes up and I don't think has really been answered by HSA providers yet, in terms of if I'm servicing these accounts and these individuals, can I be compensated for my work there? I think that's an area that will evolve, but is we're kind of early and there's more questions than answers probably at this point. We're also early in terms of them being a true investment vehicle with a lot of investment options. So while there are some HSA providers out there that have platforms very similar to what we're seeing with retirement plans, where you're investing in mutual funds or in similar investment vehicles, the majority of HSAs today are, for the most part, sitting in money market vehicles. That said, I think when people start to recognize the benefits that HSAs seem to have both in terms of a tax benefits with pre-tax money that's potentially growing on a tax-free basis, and the fact that there is no impact on retirement savings vehicles. The advisors that I'm seeing talking about this are really doing it as a value add at this point, particularly if I'm a plan advisor and I know that that employer does have a high deductible plan, and I know that those plan participants perhaps have access to an HSA. I think it is a new avenue to conduct some education around. Where you're seeing people be a little bit maybe more strategic is if I have plans that are perhaps having discrimination testing challenges, or people are just in a place where they want to save more because contributions to an HSA do not have an impact on contributions to a retirement plan. That's opening a door as a new avenue for those that are able to or interested to shelter some more income on a pre-tax basis that might grow either tax deferred or tax free.
Okay. And are you seeing success stories related to this with advisors partnering up with healthcare brokers and consultants, or really just attacking it from the perspective of when they're involved either with someone's personal wealth picture or as part of the retirement plan conversation?
I think we're seeing both. I think, in some cases we are seeing the traditional kind of financial advisor or plan advisor start to have some more open dialogue with the benefits specialist or person. Again, we're early there, and I think both parties are trying to figure out how do we play nice in the same sandbox together, because historically there was kind of this wall or barrier between the two. But this clearly is an opportunity for them to partner in how they service their common client. And a lot of this really is in terms of how advisors are working with the individual client or the individual participant, just being a little bit more consultative in terms of that holistic view or approach to how we save for retirement, and recognizing that this really could be a new retirement savings vehicle if somebody wants to make it one.
Okay. And do you have any kind of ground level thinking of what Oppenheimer's role might be in this? Are you pursuing anything in the HSA channel that you can speak to at this point in time?
We're not at this point in time. So and I think Oppenheimer as well as probably most mutual fund companies right now are watching the pretty rapid evolution of this space. So with investable HSA providers, oftentimes they're going through a custodian or a trading platform very similar to what retirement providers are doing, where in theory an HSA investor could have access to really a full array of different mutual funds and mutual fund companies. So, we as a fund family, as will others, will participate in those offerings. If we're not, and oftentimes we're already there because those same custodians and trading platforms are being utilized on the retirement side. And I don't know that this ever becomes, kind of what 401ks were in the 80s and 90s, where most mutual fund companies had, kind of were in the retirement plan business with proprietary product. I don't think we ever go back to those days, but I think, much like, Epic as a record keeper has access to multiple trading platforms and custodians. I think HSAs will become that, will be a participant on the investment only side.
Great. And similar sentiments from the Epic side. I mean, this is something that we're actively discussing at the executive and strategic level. We have not, launched to the public any formal initiative at this time, but, as we're having these conversations and discussing where this is headed, we'd love to hear from you on the phone as to how you're positioning this within your practice and what you might want to see from Epic to help support that. So certainly encourage you to reach out to me or your sales consultant or your relationship manager at Epic to chat about this further and really help shape where we go with this on the Epic side. All right. And with that, I think that does it for today. So thanks again to Rob and to Oppenheimer Funds, and thanks to everyone on the phone for joining us for this installment of Epic Insight. We appreciate your partnership. Look forward to working with you in the future, and wish everyone happy holidays. So thanks.
Thank you.